Let's talk about everything you need to know about hand expressing and harvesting colostrum. Hello, my friend. I am Jess, breastfeeding specialist and mother to 3 incredible human beings. And this channel is all about guiding you through that first year of motherhood so you can step away from overwhelm and into confidence. So let's talk about hand expression. It's not just for collecting colostrum. You'll also find that as you breastfeed, hand expression is just a wonderful tool to have around to relieve engorgement, to increase milk supply, and to get milk out for a more comfortable feeding. Grab a cup and let's talk. I remember going away for a weekend with my husband when our baby was about 8 months old, and I didn't think I'd need a pump, and I didn't bring one. And I was so glad that I knew how to properly hand express to relieve that engorgement so I wasn't so uncomfortable during that night away. So the first step in hand expressing is wash your hands and dry them. And then you're gonna start to massage the breast. So using your knuckles, move in circular motions, move around for about 3 minutes, and you're just softening the breast tissue to help, and adding warmth, which is gonna help soften them up. It's gonna get the milk out even faster. You could also start by getting like a hot washcloth, or I would put rice in a clean, fresh sock, or putting rice in a sock and putting it in the microwave. It's like a way to heat up and warm up your skin, loosen it up a little bit, get the breast ready to release milk. And then you're going to do a little bit of nipple stimulation. What this is doing is it's getting the hormone oxytocin to start working. It is also signaling your body that it's time to start releasing milk. Next, you're going to take a C shape, and what you're going to do is put it right outside your areola, put it right outside the areola, and then take 2 fingers up above the thumb. That is where your hand should be. So it's just a little bit past where the areola ends. You're going to push down, push forward. This shouldn't hurt you, but you are applying pressure, right? We're not milking a cow here. We are applying firm pressure down and push forward. And what I would always do is I'd kind of like rub my thumb forward with it too, because I found that that helped me just get a little bit more milk out. Moving around. Keeping that C shape. At this point, you'll notice some milk appearing. If you're wanting to harvest colostrum, don't start doing this before 36 weeks. Wait until, it's usually safe for women around 37 to 38 weeks pregnant, but of course, talk to your doctor first. Your circumstance might be different. At this point, you might notice some milk coming out. It might take a few minutes, anywhere from like 3 minutes to 5 minutes of this hand expression, until you'll start to see small yellow droplets coming out. This is your colostrum. You can start to collect it. You can collect it in a spoon. You can collect it in a cup. What I loved so much, I only had this in my last pregnancy, were these Haka colostrum collectors. They're so soft. You can roll them up to like get every little bit out. They come apart. They're so easy to use, and they're easy to clean, and they're comfortable. But you can take it as your hand expressing and just collect it right there. Or I would just put it right into a cup and then I'd suck it up with this afterwards. You can put these in the freezer if your baby gets sick. You can bring it to the hospital with you. You can use it for eye infections. You can use it for cuts. It's incredible. It's an incredible liquid. Now, what we do on one side, we're going to do on the other side and on the other breast. So using warmth, using massage. And if you are using hand expression after your baby has come and after your milk has transitioned to the whitish milk and your breasts are really full, you're just going to hand express until you feel comfortable. This is an awesome tool to use, hand expression, because it also softens the breast. When our breasts are so full, they're engorged, the nipple gets flat. It gets more flat, right? And it's harder for the baby to latch on. Just imagine like you're trying to grab something and it's really tough. It's like the end of a balloon. Versus when you can soften the breast a bit more, you can compress it, and now baby can get more of your areola, more of your breast tissue into their mouth and not just trying to grab the nipple. This will give you and baby more comfortable feeding. If you want to learn more about the magic of colostrum and exactly what it is, you can check out this video right here. I hope this video has helped. Love ya. See you, pizza.